so I could steal it. The All In with Chris Hayes super edit of Republicans and conservatives convincing themselves over and over and over again that no one was going to sign up for Obamacare. If there are people in your life who watch Fox News all day long, you should know that they have had drilled into them over a period of months now these confident, no doubt claims of certainty that Obamacare would die, that Obamacare would become non-viable in numerical terms because Americans would just refuse to sign up for health insurance under the new guidelines set up by the Affordable Care Act. And when Obamacare therefore died in a death spiral, Fox News has been saying over and over and over again, health reform would go down in history as not just a great policy failure, but as a towering act of political folly. Democrats would spiral to their political deaths alongside the policy itself. Republicans would laugh all the way to the ballot box. That's been the story. That is not only the way that Republicans and conservatives have been talking with each other about this policy issue on Fox News and in every other Republican circle. It's also, in some ways, the sum total of the whole Republican electoral strategy for this year's midterm elections and beyond. The supposed death spiral, the expected death spiral, it has been everything to them. They have been banking on the spectacular and obvious failure of Obamacare due to Americans not signing up for health insurance. That is not the way it has turned out.
What number are you?
It's been a rush going into this last day, lines around the block at enrollment centers.
Find out the most affordable coverage for you.
The administration reports 2.5 million calls last week to its hotline, more than the entire month of February, and nearly 9 million hits last week on healthcare.gov.
If yesterday's events were any indication of the crowds you will see today, you just might be in for a long wait.
You're seeing a huge uptick in the amount of people who are coming out.
I went to several other locations, and they was overcrowded.
ABC's Chief White House correspondent Jonathan Karl now on the surge and the sprint to the finish.
In Dallas today, hundreds of people waited in line to sign up for health care.
We will be here till 9 o'clock or till the last person leaves today.
Long lines in Miami, too, and San Antonio.
People started lining up at this mall in Miami at 3:30 this morning. By noon, more than 1,000 had come here to try to sign up for Obamacare.
In San Antonio, long lines filled the Alamo Dome. In Tampa, they crammed community center hallways.
Some people coming with tablets.
Administration officials say this has been their biggest enrollment day since signups began last October, 3 times their previous record.
Now, it is not a totally hard and fast deadline today because lots of people will be granted extensions, including anybody who tried to sign up by today but had technical troubles for whatever reason. But on paper, at least, today is the day, the deadline by which you are supposed to have signed up for health insurance directly with an insurance company or through the health exchange websites that were set up by the new law or through a government insurance program like Medicaid. Today is the day. And the Congressional Budget Office had projected initially that by today, 7 million people would have enrolled for health insurance through the exchanges. They revised that down to 6 million people when the federal website and a bunch of state websites had a super glitchy launch. But not only was there no death spiral, that projected 6 million people, that's 6 million people expected to sign up, that projection was hit and surpassed even before the deadline. The White House announced last week that they were already at 6 million signups. They were at that threshold 4 days ahead of today's deadline. And then, by all accounts, over this past weekend and through today, including through tonight right now, the last-minute surge of people trying to enroll, trying to get themselves health insurance, has been a substantial surge. The healthcare.gov website, that's the federal website that works in 36 states that don't have their own websites. Healthcare.gov has been running pretty well over the past few months since they fixed the initial glitches. This morning, though, it went down for a few hours again because of a software glitch that they found overnight. They apparently fixed that glitch by this morning and had the website back up and running today. But then just after lunchtime, in the early afternoon today, the healthcare.gov website crashed again. And this time it wasn't a glitch. This time it was just overwhelmed by the sheer numbers of people who were trying to sign up for health insurance all at once. The administration said they were dealing with more than 100,000 people all on the same website, all simultaneously. simultaneously trying to enroll, and the site just got overwhelmed. They did get the website back up and running for a second time today, but throughout today and into tonight, they say the volume is very, very high on the website. Volume is also high at the call centers where people have been trying to phone in order to sign up that way. At the Federal Exchange and at the call centers, they're now saying that anybody who essentially gets in line between now and midnight, anybody who at least tries to get themselves signed up today, will have the deadline stretched for them so they can at least try to finish the process. If you've put it off until the last day and you are trying to sign up for health insurance before the midnight deadline tonight, yeah, the fact that all the call centers are really crowded and there's long lines and it's taking a long time to get through the website because it's really overwhelmed, it is probably really annoying to be doing this at the last minute. But that annoyance is not a death spiral problem. This is the opposite of that kind of problem. This is not too few people signing up. This is too many people trying to sign up. If the health of our newly reformed healthcare system in this country depends on people agreeing to participate in the system, people agreeing to get health insurance, well, then this is exactly the right kind of problem that you want to have. It may be annoying, but this is the type of difficulty that they dreamt of. It's too popular.